Good morning, everybody. It's my honor and pleasure to be with you this morning as we close out this Head and Neck Cancer Symposium. My name is Jeff White, and I'm going to share with you a little bit about my cancer experience. Oh, there he is. Okay, good. My partner's here. Oh, it's all moving without me doing anything. There we go. My only disclosure is that I actually work for ASTRO. I'm their Director of Public Relations and Strategic Communications, but other than that, I have no conflicts. This way, okay. I'll spend a little bit of time talking about me before I get into my cancer experience. Some of you in the room may know me through ASTRO. I've been with ASTRO for about 8 years, and I'm known as PR Jeff White on social media, and I work with ASTRO in a variety of capacities, including promoting the specialty and the science happening in the field, as well as managing our media and social media programs. I want to take a moment to say thank you to every one of you in this room, because you've chosen a career path that puts you in the cancer space every day. On behalf of myself working at ASTRO and on behalf of myself as a cancer patient, thank you so much for all that you do. I see your commitment to cancer. I see your commitment to patients every day. And I just want to say a sincere thank you up front. I don't know how to do this. I also want to thank 3 special people, 2 of whom are in the room today, which adds an extra level of complexity to this talk. The 3 main doctors in my cancer journey are Dr. Bruce Davidson at Georgetown, and from Inova Shar Cancer Center, Dr. Paul Bajaj, my friend and my radiation oncologist, and Dr. John Deacon, my medical oncologist, who became my friend. Because of the 3 of you and your incredible teams, I'm here today and in overall good health. My story started in May of 2023. One morning I was in the shower and I felt a lump on the right side of my neck. And I thought, I don't remember that before. I had just had a physical a few weeks prior and all my blood work was normal. Everything came back completely fine. There was nothing suspicious. The lump didn't hurt. So I really didn't think much of it. By coincidence, I had a dermatology appointment that week. And when my doctor walked in the room, the first thing he said was, "What's going on with your neck?" And I explained, I didn't think anything was happening. It didn't hurt. And he said, "Well, have you had a recent cold?" And I said, "I had." And he said, "Well, if it doesn't go away in 2 weeks, just call your primary care doctor." 2 weeks later, it was still there, maybe a little less pronounced. So I made an appointment with a primary care physician. And it wasn't my primary care doctor, it was someone new to me. And I went in pretty blasé, and I just said, I have this lump. And the energy in the room quickly changed. He asked about weight loss, night sweats, and other possible symptoms. And my answers to all of them were no, but I could sense the intensity was changing in the room. And I asked, what's happening? And he said he was trying to rule out malignant lymphoma. He hadn't even examined me, and he went straight to a possible malignancy. Needless to say, the room kind of started spinning, and I felt like I'd been given an electric charge and just kind of sank in my chair. He recommended that I get it biopsied, and he gave me the name of a nearby facility. I literally called from the lobby when I left his room. They said they could see me in 3 weeks. I booked it. I hung up and I thought, how am I going to sit with this for 3 weeks? This is where it pays to have a relationship with a radiation oncologist through ASTRO. When I told my boss what was happening, she told me, call Dr. Bajaj and see if he can help you get in sooner. It hadn't even dawned on me to do anything like that. Thankfully, he arranged a biopsy at Inova the very next day. I had a needle biopsy, and within minutes they said it was a benign cyst. That was a huge sigh of relief. The recommendation was that if I wanted it removed, I could see a surgeon, but it was up to me, and rest assured it was benign. And I thought, well, I might as well just get it taken care of. So at Dr. Bajaj's recommendation, I booked an appointment for a few weeks later with Dr. Bruce Davidson in Georgetown. I went into that appointment thinking, this is no big deal. I'm just gonna have this removed. But within 2 minutes of the exam, Dr. Davidson said, I don't think that's what you think this is. He's like, I think it might be related to tonsil cancer. Cancer. Again, I was blindsided and I felt like an electric charge went through my body. He recommended a tonsil biopsy, and I had to wait about a week for that biopsy, which was an intense 7 days. I was really struggling with what it possibly could be, and I went through every possible scenario of what it should be other than cancer. But literally the day before the biopsy, I had kind of decided, he probably knows what he's talking about. So I kind of accepted that that's probably what it was gonna be. After I was awoken from the biopsy, they confirmed it was cancer. It appeared to be HPV positive and early stage, which was good, but I would be needed to be scheduled for surgery and a neck dissection. I had surgery about a month later. They removed 24 lymph nodes and my tonsil. After surgery, I recovered having to endure a week of no solid foods and not speaking. My partner, Patrick, loved the no speaking part, but I made him eat at Whole Foods every day because the smell of the food in the house was killing me, so it was making me incredibly hungry. A week later, I went back for my pathology results, oddly confident because I already knew I had cancer and that they were gonna take it out. But at the meeting, I learned that it had spread to my lymph nodes. My treatment plan, which was initially gonna be radiation therapy, now included the addition of chemotherapy. And that was a really, really hard reality for me to swallow. Then came the waiting game to regain strength for the radiation and chemo to come. At Inova, I started looking at patient education materials about radiation therapy, given that this is the world I'm in. And I think we all know that patients aren't generally exposed to radiation therapy information unless they actually need it. And many people have outdated understandings of what radiation therapy is today. Standing in the waiting area, looking at the materials was the moment I decided to chronicle my experience and try to use it as an educational opportunity to help alleviate fears and misperceptions for other patients. As anxious as I was about the odyssey ahead of me, the thought of being able to chronicle this to help future patients gave me a strong sense of purpose and calm. During radiation chemo, my world flipped upside down. I went from taking a single multivitamin to taking an array of medicines throughout the day for pain, mucosis, eating, sleeping, and any other possible side effects. It was a whole new world that I just wasn't used to. My world also became a logistical challenge with so many appointments to manage and attend. I had to keep a calendar at the ready to write down all the different appointments for blood works, exams, treatments, and more. Here's a fun fact. Did you know there are 10,080 minutes in a week? If you get 30 minutes alone with your doctor, that leaves you with 10,050 minutes alone in your own head, wondering what is happening with your body, what this feels like, what does that mean, and what's your future gonna be? That is a lot of time in your own head. By the time you get to the doctor's office, you're overwhelmed. These short appointments are critical, but they're so full of pressure and anxiety that many of them I barely remember. Sitting alone in the exam rooms was overwhelming, especially waiting for scan or blood work results. Those appointments are filled with stress. I'm not saying that I had a lot of long wait times. It's just that when you're sitting in that room waiting for somebody to come through the other side, they could be giving you any sort of major news that you weren't expecting earlier. I started a tradition of sending these photos to my two best friends because it made me feel less lonely. So it got to be our little tradition to manage my stress. But I'm only giving you 4 of the ones that I took over time. Eventually, I completed 33 radiation treatments and the 6 rounds of chemo with cisplatin. I am grateful for every nurse practitioner, tech, and doctor who helped me. I chose not to ring the bell at the end, and that was a personal decision. I was exhausted, and I just wanted to go home. I was taking photos and videos of my progress along the way and how my skin was being impacted by the radiation. And then at one point, I just decided to stop doing that for a couple of reasons. One was I didn't want to remember that. It was rough to look at. And 2, I also recognized that every patient's experience is different. And I didn't want to set expectations for what it was going to be like for someone else. I think I did better than expected in some ways and worse in others. I'm not changing that. I don't know how that works. I included, I had a 4-day hospitalization at the end of chemo. Every patient's journey is unique, so I just decided when I engage with patients, I'm going to meet them where they are and find out how they're doing before I kind of share what I went through. It truly took a village. Sorry. I'm not someone who asked for help, but I knew I couldn't do this alone. I knew enough to know that. And so I have to give a special shout out to my partner, Patrick, who came with me to most of my appointments and had to do all the heavy lifting when it came to my physical and mental care. I know it wasn't easy for him to watch me suffer, but he was a strong, calm presence for me, and he was always there. I'm so sorry. This is not what I wanted to do. I also need to thank my coworker and my work wife, Sam Dawes, who's at the bottom right there, who insisted she come with me to many of my initial appointments as I was so overwhelmed and scared. I knew a lot about cancer, and I was overwhelmed. I couldn't quite process what the doctors were telling me. Many times I didn't know what questions to ask or whether what a doctor was telling me was good news or bad news. And Sam was a constant, reassuring presence through every step of the process. I can't look at her. And then here are just some other folks who helped me, including I was happily connected with some other head and neck cancer patients. So we had great conversations kind of leading up to everything. They kind of helped me understand what their process was like. And then there's a couple of people that you may know in this room who were also very kind and took good care of me and checked on me throughout my process. One of my mantras that my team knows well is know your audience. And since today I have an audience of physicians, I thought I would give you all some things to think about. The first 2 were be repetitive on the good news and meet your patients where they are. I know you understand these 2 things, but reading the room matters. There are 2 moments I distinctly remember that were helpful for me. And one was Dr. Bajaj telling me, we're treating you with curative intent. After this is over, you'll still be Jeff White. You'll just be Jeff White 2.0. I was in the middle of treatment when he told me that, and it was like I was hearing it for the first time. I literally said, wait, what did you just say? So I knew it at the beginning, but when you're in all of it, you kind of lose sight of it all. And so it was like I was hearing it for the first time. So I work in cancer, but imagine what it's like for your patients who don't have the knowledge that I have. The other thing was looking at my scans. I hated it. And it would fill me with such anxiety to see the images on the screens and know that the highlighted spots were cancer in my body. And one day, Dr. Bajaj asked me, do you even want to see your scan? And I immediately said, nope. And I was so grateful that he said that. And he said it was okay to do, and we just kind of talked through what he was finding, and I always appreciated that. And while I know you deal with issues around side effects every day, it's not overstating it to say that some of the effects from these treatments are very, very challenging. I knew the skin issues would be rough, and being a fair-haired person, I watched my skin go from a light red to a deep red and then to a pretty intense peeling. It was not pleasant, and that's another reason that I stopped taking pictures of my progress, as I didn't want to remember this at all. The mouth sores were another side effect that was debilitating. Sore is too gentle a word for what it was like. It was pain like I've never experienced, and while it was normal, it made eating, which we all know is critical, nearly impossible. The magic mouthwash by that point wasn't really able to touch the pain for me. And I'm glad I was vocal about the pain I was feeling, because ultimately I got a lidocaine gel that then allowed me about 10 minutes to wolf down some food. So I tell other patients to get some of that as early as possible, because I think it really did make a huge difference for me. While outwardly I'm good and my surgical and RT scars are barely noticeable, I won't lie that there are internal scars that I'm still processing from my whole health odyssey. I did have a post-treatment period of deep sadness and depression about 6 months after I finished treatment. I didn't really know what was going on. I just felt this overwhelming sense of sadness. It's a lot to hold in, and it's a lot to process as life is happening around you, even as you're going through your treatment. I live in Washington, D.C. My father was in California and was in declining health. And I couldn't be with him. So just kind of having that anxiety of knowing what was happening for him while I needed to be, in D.C. for my treatments added a level of stress and complexity that's hard to describe. I'm not a shy person, and I'm good about talking through my feelings. So it was nice that Inova had mental health support services available for free, and I was not ashamed or afraid to use them as the stress continued with follow-up exams and scans. I'm also not a big fan of surprises, and as you have heard, I got a lot of big surprises in my life. It's kind of given me PTSD around going to any doctor's appointments. And I was also proud of myself that one of the first things I asked for when this whole experience started was I needed a prescription for anxiety. Never in my life have I ever taken anything like that, and I was scared to do it, but I'm thankful that I did it, and it helps me when it's needed. And I will admit that I may have taken some this morning. I'm almost done. Since treatment, I've taken on a new role, speaking as a patient. My social media posts as a cancer communicator, becoming a cancer patient, did generate some interest. And I initially posted as I knew that my community of radiation oncologists would be supportive, but I never could have imagined just how supportive and how caring our doctors were to me. They were busy with their days, busy with their patients every day, Yet I was getting direct messages and text messages and emails from doctors all over the country just checking on me, and that meant the world to me. I've done some interviews, I've been invited to do a couple of podcasts, and I shared my story on RT Answers, which is ASTRO's patient education website. I've also become a patient ambassador for the Head and Neck Cancer Alliance, and I'm thankful that they're here with us today. I also serve as a volunteer member with Immerman Angels, where I was paired with another patient who was kind of going through a similar process. And we had great conversations, and the feedback that I got from her was, she's like, I learned more in this 45 minutes with you because I could understand what you were talking about versus my doctor's appointments because I get too overwhelmed. I've also started participating in a head and neck cancer subreddit on Reddit, and it really is fantastic, and I wish I'd known about it during my experience. It's really patient to patient talking about the process, and I find it a very satisfying way to help others. And I just want to put it out there today that if any of you in your clinic have any need for patient voices, I'm happy to support and be a part of it in any way. So again, I just want to thank you for your dedication to oncology, your commitment to your patients, and for the opportunity to share my story today. Thank you.